Osteoporosis is defined as a skeletal disorder of the bones, in which there's a reduction in the amount of strength in the bones. The bones are less strong than they should be because of, in most cases, a loss of bone, which occurs as we get older. And accompanying that loss of bone is a damage to the bone structure. The bones become weakened by this, and as a consequence, are much more likely to break. So with osteoporosis, what we're trying to do is prevent broken bones. People ask all the time, when should I start thinking about osteoporosis? Well, I think that one of the things that's useful is when a woman is just reaching menopause, it's a good idea to have a conversation with her doctor about risk factors for future osteoporosis. Menopause is when your estrogen levels drop quite substantially, and that's when you start to have some significant bone loss. Not everybody at menopause needs a bone density test, but everybody at menopause needs to talk about risk factors. Now, if you're already 65, guidelines say that you should have a bone density test if you haven't had one yet, because you're now old enough that if your bone density test isn't very good, you probably need to be treated to protect you from future fractures. But what if you're under 65, if you're 58 or 59 or 55 and you've already had menopause, you've stopped menstruating? If you've got risk factors for fracture, for example, if your mother or father broke a hip, or if you've been on a medication that's not good for bone, or if you've had a medical condition that's not good for bone, you may want to do that bone density test sooner, maybe around the time that you're first postmenopausal or sometime before the age of 65. If you're a man, most guidelines say that if you've gotten to be 70 and you haven't had the test, you ought to have the test. Again, because a 70-year-old man who has not such good scores on the test needs to be treated to try to prevent those future fractures for which he might be at high risk. Osteoporosis is diagnosed in one of several ways. One of the commonest ways that's used today, which is very, very good, is to do a test called a bone mineral density test, sometimes referred to as a DEXA test. This test, which is painless and non-invasive, takes just a few minutes, doesn't even require taking your clothes off, involves lying on a table and having a kind of a scan done over parts of the spine, over parts of the hip, and in many cases also involving the arm. And when you calculate the bone mineral density of these sites, you get a score which is called a T-score. In many cases, the T-score will be normal, meaning that you don't have any problem with your bones. But if there is a reduction in the amount of bone, the T-score will be lower than normal. At one level of lowness, it's called low bone mass or osteopenia, and the T-score would be somewhere between -1 and -2.49. If the T-score is -2.5 or lower at the spine or at a part of the hip, the word osteoporosis is used. The lower the T-score, the greater the potential risk for fractures. So that's one way to make the diagnosis. A second way to make the diagnosis would be if an older individual has already broken a hip, or if an older individual, and by older I mean after about the age of 50, a woman or a man, if that individual has low bone mass, doesn't yet have an osteoporotic score by DEXA, but has low bone mass, but has already had a spine fracture, a wrist fracture, a shoulder fracture, or a pelvis fracture, that is considered osteoporosis. A third way to use the term osteoporosis diagnostically is by making a calculation called FRAX. FRAX is a little tool that you get from a website that combines the bone density at the hip with yes-no answers to a series of risk factor questions that impact on the quality of bone and on the risk of fracture. And if your FRAX score, which is easily calculated, turns out to be above certain cut points, the term osteoporosis can be used.